Robert F. Kennedy just terminated 22 of the mRNA vaccine programs of about 500 million in the past few days. I'm going to take you through what he said and give you some ideas about the science. I'm not the kind of guy to say, I told you so, but I told you so. There's a reason why I was able to predict these things. And it's not because I'm bright. It's just because science tells you exactly what is going to happen. And so what you have to be concerned about is not the fact that we were predicting these things from even 2021. It's now 2025. What you have to worry about is what else am I predicting based on an extrapolation of the science that hasn't happened yet. That's the problem. And listen, you must realize that this kind of conversation comes at a cost. So before I take you through the RFK, just to let you know something, I don't say this often, but because of these points that I make that are so challenging to a narrative, my reach has been suppressed by, I would say, almost 95%. This is the reality as to what is going on at the moment. And what you have to realize is that this kind of challenge comes at a cost. Don't let them win. And so all you have to do is very simply comment, like, and share. I don't know if you can click the subscribe button because I used to have almost 10,000 new subscribers a month. These days, I lose subscribers. That's how significant it is. So I don't have an answer for that. But the point is, this is what happens when you challenge the narrative. So let's take you through a few things. And before I start, just to remember that coming up in the next few days is our neuro-COVID, the neurological aftermath of COVID-19, critical conversation. This is part of the prediction. And believe me, you need to know what's going to happen next. Forget what you think. This is still a huge crisis in front of us. So what I'm going to do is now I'm going to play something from what Secretary Kennedy was saying. I'll pause and give you some ideas about the science as we go along. So let's listen to what he had to say.
Hi, it's Robert F. Kennedy Jr. here, your HHS secretary. At HHS, we have a division called the Biomedical Advanced Research and Development Authority, or BARDA. BARDA drives some of our most advanced scientific research. It funds developments of vaccines, drugs, diagnostics, and other tools to fight emerging diseases and national health threats. Over the past few weeks, BARDA reviewed 22 mRNA vaccine development investments and began canceling them. Let me explain why. Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract.
Pause right there. Now, this was said from the start. You have to understand that when it comes to the way how this virus especially works, without an understanding as to what it does, you will think that a vaccine would work in the standard way for it. So just to give you an idea in terms of what goes on, when you talk about trying to prevent infection, you have to know what happens with this virus. And usually what I say to people is that there are multiple types of immunity. It's not just immunity. You have mucosal immunity, you have systemic immunity in the bloodstream, you have skin immunity, you have brain immunity, you have multiple, you have immunity in the urinary tract, in the intestines, all over the body, you have different immune systems. And for respiratory viruses, What you need is a very sophisticated mucosal immune system to fight against this. Now, if you had good immunity against SARS-CoV-2, it wouldn't mean that you have good immunity against a norovirus that targets your intestine. You need good immunity against a norovirus that targets your intestine. And so the point is that for every part of the body, the immune system is critical. And in the context of SARS-CoV-2, because it's so good at evading this immune response, and this immune response in the mucosa is very sophisticated. The virus has to break through mucus, then it has to get onto the cilia, infect the cell. Then once it has infected the cell, it has to then break back through the mucus to spread to other cells. And then even if it got through that, it then has to penetrate this immune defense in the submucosa in order to get into the bloodstream. This is a sophisticated system. And fundamentally, the reality is that an injectable vaccine cannot effectively train mucosal immunity. There are some viruses that you can get away with in terms of what it does. But the reality is that for a virus like SARS-CoV-2, where it primarily is focused on the upper airway early before it then gets in the bloodstream, and it has extremely good evasion tactics, the only way to try and get beyond it is to have good mucosal immunity. And part of the problem is to do, well, I'll come to that when he comes to that in his talk. Let's just continue to listen to what he had to say.
Right. Here's the problem. mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomena called antigenic shift.
Pausing him here again. When he's talking about this mutation, this is actually a very important point. And what has happened is that when you look at how the virus is, and I'm going to show you again on the slide so that you understand what I'm talking about here. I've gone over this many times, but sometimes it's important to go over it again. This here is the coronavirus structure. As I said, it's like a ball, a gray ball, with the spike protein sticking out of it. And each spike protein has 3 points of where it can infect the cells. It's a trimeric spike protein. And this is the key that opens the lock to get inside of your cell. So in the wisdom, they recognize that this is the most immunogenic part of the virus. And so therefore it makes sense to take the spike protein and then train the immune system to fight against this spike protein. But you must note that the spike protein is only one part of the virus. You have here in orange is the envelope protein. There's a membrane protein. There's a nuclear capsid protein. They are ORF proteins that are produced inside when the virus infects the cell. There are lots of targets that the body uses to get to the virus. And what was even most interesting is that when you looked at initially when people were infected, natural immunity, most of the targeting was to ORF proteins, not necessarily the spike protein. That was only 21% of its targeting. And what that indicates is that the immune system had worked out that the most efficient way of dealing with this virus was cell-mediated immunity. That means you don't use missiles, you use marines. And that's the kind of thing that the immune system can work out that is not so easy to do if you don't understand what is happening. And let's hear what he has to say.
Meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine.
Pause here again. Actually, you need to listen to the bit that he says. Let him finish this, and I'll come back to what he's talking about here.
Millions of people, maybe even you or someone you know, caught the Omicron variant despite being vaccinated. That's because a single mutation can make mRNA vaccines ineffective. The same risk applies to flu. After reviewing the science and consulting top experts at NIH and FDA, HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses.
Pause there a minute. And I think it's important to listen again, because when we think about what Gert had said in 2021, listen again. I've pulled it back so that you can hear it again. So let's listen.
Encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine.
Pause. As I said, that is exactly what Gert was saying about vaccinating in the middle of a pandemic. He was shouting from the rooftops. He has continued to talk about this. He hasn't given up because it is so serious, so important. He sacrificed his reputation for the sake of the truth. And there you have it. He said it. I didn't make it up. I can only assume he must have been talking to Gert or watching what Gert had been doing, because he has finally said what it is that we had been pointing out, that if you get viral variants because the virus is evading the immunity from the vaccine, you will never stop the circulation. And you don't even realize how serious this is. We are at a situation that is the worst outcome that we could have ever had in the context of the pandemic. You have primed the immune system through vaccination in highly vaccinated regions, and you cannot control the circulation of the virus. People are getting reinfected after reinfection, and they have an immune primed situation that is going to drive chronic disease. I mean, you couldn't have made it worse. That's my view on this. This is like the nightmare scenario when we looked at this in 2021.
Millions of people, maybe even you or someone you know, caught the Omicron variant despite being vaccinated. That's because a single mutation can make mRNA vaccines ineffective. The same risk applies to flu. After reviewing the science and consulting top experts at NIH and FDA, HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses. That's why, after extensive review, BARDA has begun the process of terminating these 22 contracts totaling just under $500 million. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate.
I just pause him here a minute. Now, in the midst of making one decision, let's hope he doesn't mess up with the other one, which is that whole virus vaccines were used in the pandemic in China and many parts of the world that took the Chinese vaccines. There are inherently problems with using whole virus vaccines for COVID. Let me say clearly at this point, there are some diseases that are not easily amenable to vaccination. Based on the research, based on our research about autoimmune responses related to COVID infection, so the cytokine storm is not a viral storm, it's an immune storm. Your immune system goes into overdrive triggered by the virus. You can argue about whether it's ACE2 or something else, but the immune system goes into overdrive. So what kills people is their immune system. How in the world do you train it to respond to the virus but not overreact to the virus. That's the problem. That's the challenge. And that's why I say when they are thinking about this virus, please think carefully and don't follow a narrative, because similar to dengue, where you can have immune refocusing and it's locked in a particular position and you get dengue hemorrhagic fever on reinfection, I suspect that this is where we are with this kind of virus. You have got to be very, very careful.
Let me be absolutely clear. HHS supports safe, effective vaccines for every American who wants them. That's why we're moving beyond the limitations of mRNA for respiratory viruses and investing in better solutions. Thank you.
Produced by the U.S. Department of Health and Human Services.
Well, as I said, we've heard what he has said there. And for many people, they think this is the end. For me, I don't think this is going to be so straightforward. I'll tell you why. This is the reality. This is an American company that is primarily focused on mRNA technology. Its peak over the 5 years was in 2021, October 2021. And since then, it has been on a gradual downward decline. The two biggest shareholders, institutional shareholders, are Vanguard and BlackRock. They are not going to lose their money without a fight. So I don't know if even if what happens in the next week or so, if this does happen, he will be called in and he may have to reverse the decision, because for whatever reason they come up with, but maybe it can work, or I don't know what. But the damage may already have been done, because it has been very clearly demonstrated that from their research, they don't think this is the way forward. And so even if there is an attempt to pull back on this, I am not sure that the public will believe it. But I expect that this will not happen without a fight. This is not over. Too much money is involved. But here is the truth. When I look at where we are now, my concern is no longer about the vaccines. Only a small number of people are taking it. It produces IgG4, which in the context of an hyperactive immune system has some benefits. We are in, as I said, the nightmare situation where a virus is still circulating. Populations have been immune primed, and people are going to get very sick. The difference with what I think with what Gert had said is that Gert is looking out for Hivicron, a viral variant that's just going to sweep through and cause huge damage. I am not sure if this is how it's going to play out. I think this is going to be more death from 1,000 cuts, meaning that each infection knocks off another part of the organ, whether it's the heart, it's the brain, it's the kidney, and this process just keeps on going because the virus keeps on reinfecting those who are vaccinated. For those who have natural immunity, they have a huge advantage. It doesn't mean that they're completely safe, because everything is about preventing the spike protein getting into the bloodstream from infection as well. And so whoever is able to do this most effectively is going to do the best from a health point of view. But I think that this is just the beginning of a surge of disease and illness that may take a full decade to be realized. But the outcomes, sadly, if they continue on the trajectory that they're going now, are only going to get worse. Let's hope we can find ways to fix this, but at least there is a chance if the right decisions are made at the top. Have a good evening.